Okay, Congressman, we are ready to go.
Austin?
Yes, and thank you everyone for their patience. So good evening. Welcome to Congressman Bobby Scott's public health webinar on COVID-19. My name is Austin, like he said, and I'm going to be the moderator for this event. As a reminder, we are holding this webinar on Zoom and streaming live. So if you have a question, please feel free to use the Q&A function, and you can leave your question in the chat as well. And if you're joining via social media, feel free to ask your question in the comments section. Now, before we begin the Q&A portion of the webinar, I'm going to hand it over to Congressman Scott for some opening remarks. So, Congressman,
Thank you. Thank you, Austin. Have you started recording yet? But thank you, Austin, and good evening. I want to thank everyone for joining us for the public health. I want to thank everyone for joining us for the public health webinar on COVID-19. And I'm pleased to be joined this evening by Dr. Jordan Asher and Dr. Keith Newby, both from Sentara Healthcare. And want to make sure that you know we'll end promptly at 8 o'clock so that everyone who wants to make the college championship game between Alabama and Georgia will not miss anything. But before I turn it over to them, I'd like to make a few opening comments and discuss the rise and spread of the Omicron variant, what Congress has done to address the COVID-19, and what we can do to protect ourselves and our communities. Now, as a reminder, if you want to ask a question, please use the Q&A function if you're on Zoom. And if you're watching on Facebook, you can leave a question in the comment section, and we'll try to answer as many questions as possible. Now, while we're seeing a rise in cases at this time, I think it's worth remembering what Congress has already done to respond to the fight against COVID-19. In the spring of 2020, we worked with President Trump to enact the Families First Coronavirus Response Act, as well as the Coronavirus Aid, Relief, and Economic Security, or the CARES Act, to combat the virus, including investing in research for the vaccine, making tests free, helping schools develop virtual learning, expanding unemployment benefits, and paid leave policies. Over the course of 2020, it became clear that much more would need to be done to address the pandemic and ensure economic crisis. So this time last year, we noticed that small businesses across the nation had been forced to close their doors. Students were falling behind in schools and were forced to shift to remote or hybrid learning to protect the health of students, parents, teachers, and staff. State and local governments across the U.S. were facing massive budget shortfalls. Millions of Americans were still out of work, and those who remained employed were not able to telework, were not adequately protected from the virus. And once the new administration came in January, we got to work on a new relief package. In March 2021, we passed the American Rescue Plan, which secured historic relief, including money in people's pockets in the form of the $1,400 stimulus checks, as well as funds to ramp up vaccinations so we could get as many shots in people's arms as quickly as possible. There's emergency funding to sustain our child care system, including nearly $800 million to support providers in Virginia. We had unprecedented funding for K through 12 education, providing funds for schools across the country to reopen schools safely, keep schools open safely, and make up for lost learning. Now, we know that we want to open the schools. Everybody knows that students do better in school, better academically when they're in school in person. We know they can't learn the important social and emotional skills if they're not in school. They don't get the proper nutrition because they're missing the school meals. You can't identify child abuse if the students aren't in school. And let's get serious, you're not going to open the economy unless you open the schools. So there is a premium and urgency to open the schools. But when we provided the money to open the schools safely, we still left it up to the local school boards to decide when it was safe to open the schools. And that has to take into consideration local situations. Those have to be in consultation with health officials, depending on what the situation is in a particular locality. But Congress provided the funds to make sure they had the money to pay the costs to open safely. Now, in addition to schools, we had relief for for public schools K through 12. We also had money for higher education to make up for their strain with people leaving school. Financial relief for struggling businesses, particularly restaurants. More funding for programs to help older Americans access food, Meals on Wheels, and programs like that. We helped laid off workers maintain their health insurance. We protected pensions for over 1 million Americans under the multi-employer pension funds. And we provided emergency financial assistance, including increasing the earned income tax credit and the child tax credit. Ultimately, during the year, we believe we cut child poverty about 50%. Biggest drop in child poverty on record is about 20%. We believe last year, with all we did, child poverty was actually reduced about 50%. Behind these real numbers, we have real Virginians who have felt the rescue plan working for them. Today, 14 million shots have been given in Virginia, but the rise in the Delta variant over the summer, and most recently, the rise and spread of the Omicron variant has presented us with new problems. While cases are rising, we have more tools than ever to keep ourselves safe and our schools and economy open. It's been a hard 22 months dealing with the pandemic, but we have a lot of work to do. But it's important, obviously, to get vaccinated. Just today, Governor Northam reported that 97% of all of the people in ventilators and hospitals in Virginia are unvaccinated. The Virginians can visit vaccinate.virginia.gov to find out where they can get their shots. And if you live outside of Virginia, you can use vaccines.gov, and the shots, you can find out where you can get your shots. We need to make sure that you get your shots to keep you and your loved ones and the community safe. And it's important to get tested if you suspect you're infected. Tests, regrettably, are not as available now as they should be, and we're working on it. But the federal agencies today are working on a plan to have insurance policies cover at least 8 tests per month without any copay or deductible. They're working with pharmacies to make sure that you can go to the pharmacy, show your card, and just like your drugs, they can work out what the insurance will pay, and there'll be no copay at the point of sale. We're working on that now. But let me call on Dr. Asher for his opening comments, and then we'll get to Dr. Newby. Dr. Asher?
Thank you so much, Congressman Scott. And it's hard to believe this has been 22 months that we have been doing this. A lot of what you said is so true. And what I want to focus on this evening is really giving everyone in the audience some realistic facts of what's going on the ground as it relates to the Omicron variant with COVID. Congressman Scott mentioned that cases are going up, and I want to talk about hospitalizations. Hospitalizations are at an all-time high. Just to give you a sense, a year ago, which was our largest peak, at any time, at the highest time, we had about 520 COVID patients in the hospital. As of this morning, we had 740. And that has gone up threefold in a 10-day period. So remarkable increase. And the reason why I bring this up is as Congressman Scott said, Congressman Scott said, vaccination is so important. And what we are seeing is even though Omicron is, everyone hears it doesn't get you as sick, it definitely can, especially if you're unvaccinated. And what we're seeing is that Omicron is so contagious that it is running through the population at a high rate. And even if the rate of illness is lower or hospitalization is lower, there are so many people getting it, it's really overflowing our hospitals once again. Governor Northam did put in an emergency act today due to that reason. Additionally, what is markedly different this time than last time that we had is our staff, who have done an incredible job for almost 2 years. They're true heroes, as we've talked about before on these calls. They are also getting sick. It's not because they're not doing what they're supposed to. It's not because they're not wearing their protective gear. It's not because they're not unvaccinated or out in the communities doing different things. It is truly just because of how infectious this virus is. And what that is causing is it's causing staffing issues. At the same time, we're seeing our highest numbers. This is especially true in our emergency departments, because as Congressman Scott said, testing isn't where we want it to be. It will get there with the administration's changes this week. They are also providing lots of at-home testing, not quite there yet, but that is coming. The major issue is that lots of people who have very mild symptoms are showing up to the emergency room to be tested. And unfortunately, the emergency room is for where you go when you truly need it, not just, unfortunately, to get tested. So all of that together, I'm very happy you asked us to share some thoughts tonight, because it's incredibly important that everyone realizes what's happening, how important it is to get vaccinated so you don't get sick, how important it is to do all the things that we are being asked to do, I know for 2 years now, and try to help us get through this time. If you're sick and you've not been tested, stay at home. If you're sick and you have been tested and you're positive, stay at home. That is true for any virus that we should have. I do also want to mention that the CDC has given very good guidance on isolation, meaning if you have COVID and you're feeling okay, because a lot of people are feeling okay, especially if they've been vaccinated and boosted, that to make sure that we stay home for those 5 days and that we are feeling better. So that is a quick update of what we are seeing. And I will turn it back over to you. Or
I'm here. I'm sorry.
I was about to say, and if not, I'll start singing a song.
Thank you. Thank you very much, Dr. Asher and Dr. Newby.
Right. And thank you, Congressman Reverend Dr. Scott. I appreciate it very much. So just to talk a little bit about vaccines. I think, a lot of times we run into a problem where people are getting the wrong impression of what vaccines are designed to do and really the importance of having them. I have people who said that they don't want to get vaccinated because they've either scared what the vaccine is going to do to them negatively, or they have various different things they've seen on the internet or social media. Probably the vast majority are untrue. I've been vaccinated. My whole family's been vaccinated. I've had a booster, the whole 9 yards, and we've done 5,000-6,000 people in my office we vaccinated with no complications and no problems. The importance of vaccinations, and this kind of brass taxes, what the vaccine is designed to do, any vaccine, is to help you build your immune system so you can fight this virus if you are exposed to it. A lot of people are saying, well, people still get the virus anyway, or they still get infected anyway, and that may occur. But understand that what it's designed to do is to help you fight it. The vaccine is like you building your army. You have, and that's the issue with Omicron, is because it's so contagious, that means it replicates so quickly, it can overtake you if you don't have your army already built. Now, again, just like any battle, it may take some time fighting it, but if you're a army of one versus an army of 1,000 of Omicron, you can just imagine what the outcome will be. So I think the first thing is understanding the importance of vaccinations and what they're designed to do, which is help you build that immune system. Second thing is dispelling the nonsensical rumors that you keep hearing, the negative things about the vaccine. People talk about side effects of it. Well, yes, you expect it to potentially have some effect if you get vaccinated. That's the whole point of it, is helping you build that immune system. The fact that you have any effects from the vaccine is actually good. That's telling me your body is creating those antibody responses that's going to help you fight this virus. Talk to other people who've had it, but make sure you get accurate information if you're going to look at it. Don't look at Facebook and TikTok and all these as your sole means of obtaining information. Look at other resources, look at reputable websites. A lot of these public health institutions that are very well known, Johns Hopkins, UNC, Chapel Hill. There are many reputable sites out there that you can get information from as well. CDC, they have, like Dr. Asher said, they have excellent guidance about what you should do if you get infected. But I would always caution people to say this: treat everyone that you're around like they have COVID-19. That's the safest thing to do. If you make an assumption that somebody around you may have it, that's going to help you be more cautious that you're wearing your mask, you're social distancing. Wearing your mask below your nose is not helping you. That's window dressing. You have to be up where it's supposed to be, because what you're doing is you're protecting those around you from getting COVID. If you are asymptomatic, you may have it and give it to someone else. And just understand that that's the important part of this, is that, your ability to infect someone else is strong. So if you're asymptomatic and you have COVID-19, your ability to give it to someone else who may not have been vaccinated, who may have multiple medical problems that may put them at risk, is going to be high. So you have to assume that those around you may have it, and always assume that you may have it and may be asymptomatic. What that's going to do is help you protect yourself and those people around you, protect your loved ones, protect your coworkers. That's what this is really all about. So stop with the nonsense about vaccinations. They are a good thing. The science is sound. It has been studied. People think we're guinea pigs. No, we're not. The science has already been done. The research has already been done. That's the whole point of all this. It's not going to get through the FDA before the research has been completed. So that has shown that it's safe and efficacious. And that's what we should be doing, which is getting vaccinated, wearing our masks, social distancing, and being careful.
Okay, well, thank you very much, Dr. Asher and Dr. Newby. Before we get to questions, I noticed that Galen Knoyton is on the call, and I'm going to ask her to come in and just say briefly a word about where you can get health care, because open enrollment for the Affordable Care Act is still available. And people need to know that there are a lot of people that are eligible this year that weren't eligible last year. And the affordability, it's a little more affordable this year than last year because the tax credits are a little more affordable. Galen, it's good to see you tonight.
Thank you.
You want to say a word about what the deadline is and how people, what kind of insurance people are getting?
Yes, thank you for having this forum tonight with some good information. So the deadline to enroll into the Affordable Care, into the health insurance marketplace, or better known as healthcare.gov, is January the 15th. You have until January the 15th to enroll or renew in a health insurance marketplace plan. Now, if you don't qualify, you can go into Medicaid. Medicaid is all year round. These government subsidies that they're giving with the healthcare.gov marketplace is very good. You have many people that are paying next to nothing for their insurance in the marketplace. And so we want to make sure that everyone, they can go to healthcare.gov, or you can come to celebratehealthcare.net, and we have people that can help. We have a navigator that can help you as well, Allison Flowers. We want to make sure that everyone enroll or renew by January the 15th to be able to go into the health insurance marketplace.
Now, are you having any events coming up? I know you had a great event over the weekend where you were doing testing and vaccinations as well as another health screenings. Do you have any events coming up?
Yes, on Friday we'll be at 6 Mount Zion from 10 to 1, and we're working on a location for Saturday. And we'll have, you can go to celebratehealthcare.net, but we're working on a location for Saturday. So because that's the deadline day, so we want to make sure that people will be able to have in-person help. And we'll have that with the vaccinations as well with the testing too.
And 6 Mount Zion, is that at
3100 Butternut Drive in Hampton?
Right off of Mercury Boulevard.
Correct.
Thank you very much.
Thank you.
Austin, do you have any questions to start off with?
Yes, we have a list of questions. And a reminder to everyone, if you have a question, you can ask it using the Q&A function, or you can put it in the chat box as well. So we have a lot of questions about testing. So Congressman, do you want to just briefly go over what the Biden administration announced today as far as people expecting to be receiving test kits at home, just a brief summary, because there are a lot of questions we have about testing.
Well, it's not, everything hadn't been locked down yet. The main thing to learn from what the administration is doing is the tests will be free. They're in the process of purchasing hundreds of millions of tests, and they'll be distributed, but it hasn't happened yet. So that's not a good answer right now, but as I think Dr. Asher indicated, we're working on it, and it shouldn't be more than a week or two before we have some tests out on the street. Dr. Asher, do you know any more about when tests are going to actually be available?
Well, what we're hearing is next week. Now, I don't know if that means Monday. I don't know if that means Friday. To your point, they are definitely being purchased right now, because we tried to order some at-home tests last week that we were just going to be able to give out to work with Gayleen and others. We got a call about 3 days later saying that the government was purchasing them and they had none to sell us. So I definitely know it is happening. Sometimes I feel like I'm being chased by an alligator trying to find tests and different things, but we're going to stay ahead of it. But that is what we are hearing. To the point around what from an insurance standpoint, what I have heard is that up to 8 tests per person per month will be paid for at your own discretion. And if your doctor is writing for more tests to be done, that those would also be covered. I have not seen that in detail, but that is what I heard today.
Thank you.
I think some of the safest things to do right now, pending that, is to be as self-protective as possible, which means go on the assumption right now that you have it if you get ill and quarantine. You know, I mean, I can't emphasize that enough. If there's a concern or an issue, assume you have it until proven otherwise. What that's going to do is protect yourself and those around you.
Gayleen, will 6 Mount Zion on Friday have testing?
Yes, we will. We'll have a limited amount, and when we only say a limited amount because we have to match the hours with the testers to make sure that we set an expectation. But you don't have to make an appointment because we don't want to have any barriers whatsoever. We want people to come in and get what they need.
Good, thank you. Austin?
Yes, we have one question actually that it looks like someone is asking, is it better to swab the throat as opposed to your nose for a more accurate diagnosis of COVID? Do either one of our doctors want to weigh in there?
Yeah, I'll take that one, and then Dr. Newby can correct me if I'm wrong or when I'm wrong. But there's been a lot of conversation about swabbing the throat, especially on home kits. Where that is coming from is there are 2 types of tests: the antigen test and the PCR test. The home kits are kits are antigen kits. And unfortunately, the sensitivity of those are lower, meaning that if I am asymptomatic, but I've been exposed, I test myself with one of these kits, that if it's negative, that doesn't mean it's negative. It just, if it's positive, it helps you. And so that's why from a testing standpoint with the home kits, they're really only if will do a lot better if you have symptoms. They're not great with Omicron for pure screening. So there's been a lot of conversation on all types of sites that says, well, maybe if we swab your throat, then we'll get more virus and the test will do better. But for any of you that have done home kits, it's hard enough swabbing your nose. The idea of swabbing your own throat will not occur. You'll get the back of your tongue because of the gag reflex. You'll choke. You'll do all types of things, and you'll feel like you're dying. And we don't want that. Also, there's different issues in the back of your throat that you don't want to be poking something hard in. Now, if you go to your doctor or another testing site of people that do testing, this is how we test for strep throat. So we might get to the point of doing some throat swabs, but definitely not for the home kits.
100% in agreement, and just remember that, again, that if you don't have enough viral particles, that's why the antigen test may not pick up a positive scenario, especially if you're too early in the test, in the post-exposure period. Getting a test a day after somebody you were exposed is not the right thing to do, because you haven't had a chance to create enough antigen to have a positive test. So I want to just reemphasize, don't feel like if you get exposed the next day or even the same day you're running out to get a test. With the few kits that are available, we don't want where people get into panic mode and start doing the test too early. They say they're negative and think they're fine. 3 days later, you may turn positive. So you don't want to do it so quickly, but just understand that, again, because you have limited kits, go on the assumption that you may have it, and just make sure you protect yourself and those around you.
Austin?
Yes. So it looks like we also have a few questions on vaccinations for Americans living abroad. So one question reads, the U.S. State Department has a policy of not providing vaccines to Americans living abroad. The State Department's recommendation is for Americans to travel back to the U.S. to get access to U.S. approved vaccines. And then is there a risk potentially for them to come back to America, bringing other variants or other COVID with them back into the country? Do we have sort of an answer to this policy? There's a few questions on this, so it's on people's minds.
Okay. Jordan, you want to take that one?
No, I don't know about overseas. I thought Congressman Scott's going to have to address this one, I guess, but I really thought those were getting vaccinated, but I could be wrong.
I'm just all about that being overly protective. I mean, if you don't have to travel right now, don't travel. But to answer the question, I mean, yes, anytime you travel abroad, depending on what variants are predominant, there's a risk of bringing something back. I mean, that's always going to be the case, but we don't know enough detail to be able to say that per se. I mean, to me, if you can get vaccinated anywhere, get it. I'm a firm believer in that.
And that's a great point. All countries are pretty much where we're going, our armed forces are vaccinating. And, to what Dr. Newby was saying earlier, even if you don't like broccoli, sometimes you got to eat it. You got to figure out how to get vaccinated.
I think both doctors have indicated that there are risks involved in travel, and coming back to the United States to get a vaccination would include risks. Hopefully you just stay here for the 2 weeks or 3 weeks to get the second shot. If it's the 2-shot protocol, it seems like something that we need to work on, because Americans living abroad need to be vaccinated. So let me find out what the State Department is doing on that. But traveling here seems like the risk involved in that may not be worth the effort. But let me check on the State Department. If whoever asked the question, if you just call the office tomorrow afternoon, we should have an answer by tomorrow afternoon.
Yeah, it's a great question, especially for this area.
Next, it is a question for you, Congressman. The pandemic has taken a terrible toll on the mental health of our youth, particularly middle and high school age students. Is there adequate help in our district for kids in crisis?
No, that's why we want them in school, because obviously you are not socializing if you're sitting at home in front of a computer screen. And if you are developing mental health challenges, we don't have any way of addressing it if you're at home. If you're coming to school, the teacher can address it. The teacher can refer to you to services. But that is one of the reasons we want children in school. The service of mental health, level of mental health services has always been, even before the pandemic, has been a challenge. There are not enough counselors in the schools. There are obviously not enough psychological services in the schools. And so this is something that we need to be working on. It's one of the reasons that one of the things that we had so much money for K through 12. The investment in K through 12 in the rescue plan was the largest federal investment in K through 12 in the history of the United States. and making sure that we had money for things like nurses and mental health professionals. People coming back from the pandemic, going to school, will be coming with mental health challenges, and you need the professionals there to deal with them. And that's one of the things the school system should be doing with the resources.
All right, next we have a question. It seems that there is some uncertainty around certain types of masks. So would our doctors care to go over the differences between a surgical mask, a cloth mask, KN95s, N95s, and the rest?
Yeah, and thanks. That's a great question, and we should have talked about that. The guidelines right now are that we are to wear procedural masks or surgical masks. And the reason why that's so important is they are 3-ply, meaning they have 3 layers, plus they have something called electrostatic activities, meaning it helps bind the virus. What we have found is cloth masks do not work as well. Now, if you want to wear 2 masks, you can wear a cloth mask over a procedure mask. And then when we talk about different types of masks, you have your procedure masks, which I just mentioned. And then the next level up is something called KN95. KN95, the 95 stands for 95% of all particles are blocked. The KN means it is not a respirator, but still a mask. And it works like a regular N95, except for the fact it doesn't fit as well as around your face. The way you can tell a difference between a KN95 and an N95, which is fitted for your mouth, you can't have a beard, it's what's worn in the hospital, is that if it has ear loops, it's an KN95. If it goes around your head in 2 places, it's an N95. Now, the difference between an N95 and a KN95 is slightly better than a procedural mask, but the procedural mask is really what we're suggesting. A key point to the procedural masks is that they're not designed to be worn every day, day in and day out. If they get soiled, if you get lipstick on it, if they get wet from talking with it on, or just from anything else, you do need to use a new one.
Next, we actually have a question. What is the future outlook for delayed non-emergency surgeries? Do we have any opinions on that?
Yes. And first of all, whoever asked the question, thanks for mentioning it as non-emergent surgeries, because people tend to talk about these as elective cases. In surgery or in healthcare, there aren't many elective cases. They're on a degree of urgency. No one says, oh, I'm choosing to get my knee replaced because it's something fun I want to do today, or my appendix needs to come out. Oh, yippee rah, type of thing. Because of what I mentioned earlier, and we are so busy and our staff is also being sick, we are having to basically decide, we're having to pull back on non-emergent surgeries. Now, anyone who requires care emergently or even urgently will have their procedure done. Okay, so I don't want anyone to take away from it. Certain things that you definitely need won't happen. They will happen. Other things might get delayed, a knee replacement for a little while. We are looking at this on a 2-week basis right now, or every couple of weeks. Now, I'm not giving specific times, and we are rescheduling them. What we're hoping is, as we have seen in South Africa and London, that this Omicron spike will hopefully end by the end of January and be fairly quick and get done. And just to give some examples of things that won't be delayed, if you need a heart procedure or heart surgery because you're having active chest pain, see Dr. Newby as a cardiologist, there's one for you. That will obviously be done. If you have an appendicitis, it will happen. It will get done. So if you need surgery, you will get it. However, we are delaying those procedures that can be delayed safely.
Dr. Asher, did the governor say anything about out-of-state doctors and how they can practice, or physician assistants and
Yeah.
liability?
Yeah. Well, the governor in his emergency act today, I wish I had him in front of me, basically laid out the same protections that we had from a healthcare perspective early in the pandemic a year ago. So it allows for certain types of clinicians to be able to give shots. It allows for licensing to happen very quickly, for doctors to come in and other staff to come in from other states. Very helpful. It allows us to expand beyond our licensed beds. Very helpful. And so it does give us those protections that we need to deal with the situation going on. So we are very grateful for that. And it's only there for, it's there right now for 30 days.
Austin?
Yes. Next, we have a question. How should employers in home healthcare handle issues when it comes to an employee when they have been exposed, since it's not good for them to get tested the same or next day? When should they get tested, and should they be working?
Well, I think a lot of it depends on the true exposure. If they've been exposed and they've been vaccinated, that can carry different recommendations. But I tell people all the time, usually especially with Omicron, about day 3 to 5, you should be able to be tested and know whether or not that's going to be positive or negative. But the one thing about it, if you have symptoms, stay home for sure.
Yep.
And I can't emphasize that enough. Symptoms, home, regardless. Even if you test negative, to me, again, because it depends on the test you get. If it's a PCR versus a antigen test, if you have symptoms, stay at home. And I tell people that all the time. But if you are exposed, if you feel it was a true exposure, if you're vaccinated, true exposure, hopefully you're wearing your mask and doing all your protective measures anyway. And Dr. Asher, I know there was some recent changes with the CDC recommendation.
Yeah, the CDC recommendations sometimes are a little confusing, but they have gotten much clearer. And basically, if you've been exposed in a big exposure or any type of exposure, and you are fully vaccinated, which means within 6 months of the 2 doses, or if you've had a booster, then and you are asymptomatic, you are free. You can go about your your activities staying masked for 10 days. Okay, which we should be doing anyway. And that's how it is. If you are not vaccinated, then you are to isolate, which means basically try to stay away from other people for 5 days. If you have symptoms or if you are positive, as Dr. Newby said, then you are to isolate. And the isolation time is 5 days, as long as you are feeling better, have no fever. And optimally, testing should be in that day 3 to 5 range, as Dr. Newby said. But you don't, right now, the guidelines don't state that you have to be tested before coming back. And we all know, just like when you go to school, there are lots of different types of vacuum cleaners. There's also lots of different types of tests. And so please, as you are doing your testing and home testing, please make sure that they are good, real tests, because unfortunately, we're hearing a lot about fake tests out there.
Austin, last question.
So we actually have some members of the press joining us, and one of them had a question for our 2 doctors. What are your thoughts on Governor Northam's new state of emergency, and do you think it will help?
I'll take that, since I'm living that world every day. Yes, absolutely. We think it was appropriate and is appropriate. Sorry about that. And absolutely, we believe it will help. It will help on being able to expand to more beds. It will help on staffing issues. It'll help on clinician issues. It will help on all types of fronts. And we are we hate to have an emergency order. No one wants an emergency order, but in the situation that we're in, when things are as busy as they are, we do appreciate that help and support from the governor's office.
Yeah, is that the final question, Congressman Scott? We have time for any
I
more?
think
or-
so. It's 8 o'clock and we promised to let people watch the championship game.
All righty. Do you have closing comments?
I want to thank Dr. Asher, Dr. Newby, and Ms. Knoyden for being with us tonight and providing the information. I want to thank all the participants who participated in the call. And if there are any questions, our website is available, bobbyscott.house.gov will be available. And so I want to thank again our panelists and thank everyone for participating. And if there's nothing more, I want to thank everybody for participating and good evening and may the best team win.